While Alexa does a literature search, I can tell you a little bit of background information on ulcer disease. The gastrointestinal or GI tract has a protective lining which protects it from the acid which flows throughout the tract. If something alters the protective lining, a small erosion in the mucosa of the GI tract can form. This is called an ulcer. If a patient has an ulcer in their stomach, you'll sometimes hear us refer to this as a peptic ulcer. This is just a reference to pepsin, which is one of the more common digestive enzymes that is common in the stomach. Several areas of the GI tract can be affected by ulcers. This includes the antrum and body of the stomach as well as the duodenum. The antrum is simply the last part of the stomach before it transitions into the small intestine, and the body or fundus refers to the remaining larger part of the stomach. The duodenum is the very first part of the small intestine, and it's unique and different from the rest of the small intestine and the large intestine in that the pH in the duodenum is quite low, similar to the stomach. This is probably why patients get ulcers in the duodenum as well as in their stomach. In children, the most common place to form an ulcer is in the antrum of the stomach. This differs from adults, where they most often get ulcers in the duodenum or the remaining part of the stomach. Now, ulcers in the GI tract are not very common in children, but they do occur. And when they occur, they can bring problems including abdominal pain, weight loss, poor appetite, or even anemia from blood loss in the GI tract. Children who have ulcers may complain of recurrent abdominal pain that sometimes gets better when they eat bland, non-spicy foods, or they may complain of something called dyspepsia, which is abdominal pain, a feeling of bloating after you eat, and sometimes even chest pain. The most common reason to get an ulcer is because of an infection with a gram-negative spiral-shaped bacterium by the name of Helicobacter pylori, or H. pylori for short. H. pylori lives in the mucus of the GI tract. And what happens is when H. pylori colonizes the mucous membranes of the GI tract, it can lead to some inflammation, and this will go on to produce the ulcerations and erosions that I talked about before. Now, if the infection and the ulceration is left untreated, patients can go on to have chronic gastritis or inflammation of their stomach or other parts of their small intestine, and something that we call peptic ulcer disease. Now, patients who have H. pylori-associated ulcer disease who don't get treatment for this sometimes can go on, in a very small percentage of patients, less than 1% actually, they can go on to get cancers of their stomach. This is why we want to treat H. pylori-associated ulcer disease early and effectively, and also why we hope in the future to have a vaccination which would prevent infection by H. pylori altogether. So I don't want to scare you about H. pylori, and a lot of people will ask us, well, doctor, how do I get H. pylori and how do I avoid it? Well, H. pylori is out there in the environment, it's very ubiquitous, and you can't really do anything to avoid it. But we do know some interesting things about H. pylori. One of those things is that the incidence of H. pylori infection increases with age. So for example, if you live in a westernized country like the United States or Canada, less than 10% of kids under the age of 12 have infection with H. pylori. This increases to about 50% by the time patients reach the age of 60. But now the incidence of H. pylori infection in developing countries is much higher. So if you live in Nigeria or other African countries or Southeast Asia, almost 100% of patients will have acquired H. pylori infection by the time they reach adulthood. We also know that the incidence of H. pylori infection is increased in patients who have lower socioeconomic status, including patients who are living in situations of overcrowding or who have issues with personal hygiene. We don't understand completely the transmission and reservoir modes for H. pylori, but we do think that it's a direct person-to-person spread. And this is because of what I just told you about things like the incidence being higher in patients who are living in settings of overcrowding. Now, it's really important to get the diagnosis of H. pylori right, and this is because treatment for H. pylori consists of at least 3 medications given multiple times each day, given for several weeks, 2 to 4 weeks actually. So before we ask patients to embark on such an intense treatment protocol, we really want to make sure we have the right diagnosis. I've spent a lot of time talking to you about H. pylori infection and ulcer disease, but physicians also talk a lot about H. pylori infection and patients who have recurrent abdominal pain who may or may not have true ulcers. Now, this might be Peter's case. He may be a patient who's having issues with recurrent abdominal pain, may have an H. pylori infection, and we don't know for sure whether he has ulcers in his GI tract or not. Now, the treatment of patients with H. pylori infection who have recurrent abdominal pain but not ulcers is controversial in the medical literature. But for today's purposes, what we want to focus on here is finding the best test in children to prove whether there is an H. pylori infection or not. And in Peter's case, because his story is so good for ulcer disease, when we figure out what the best test is, and if he comes up positive for that, we will go ahead and offer him treatment for H. pylori infection. So why don't we go examine Peter, and I'll also see how Alexa did on her literature search.
So you guys, this is Dr. Heyman. This
Hi.
is Peter and his mom, Jerry.
Nice to meet you, Peter. Nice to meet you,
Dr.
Jerry. How are you guys today?
Good.
Well, Dr. Craig has filled me in on what's been going on with your belly troubles recently. It sounds like you've got a pretty good story for having peptic ulcer disease.
All right.
And your primary care provider sent you over because he got some testing that may also implicate a certain type of bacteria is causing you some problems right now.
All right.
Does that sound right?
Mm-hmm.
Okay. Well, I'm going to need to examine you, and we're going to have Mom leave for that part of the exam. But we will kind of talk about what that test means and if we need to do any further testing to decide how to best treat you.
All right.
Okay?
Yep.
Before we have Mom leave, is there anything that you guys forgot to tell Dr. Craig that you think I should know about what's been going on?
Nope.
No?
I don't
Okay.
think so.
All right. Well, we'll do a quick exam and then bring you back in.
Okay.
Okay. Peter, I'm just going to wash my hands here, and then we're going to do a quick belly exam today, okay? Did you miss school to come here today?
Yeah.
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 Missing any tests or anything important?
Nothing important. Nothing too important.
Okay.
So.
That's good. Well, this is important so we can get you feeling better.
Yeah.
Okay. All right. I'm just going to start, first of all, by listening to your belly.
All right.
Okay, good. I apologize for the cold hands. I'm going to feel your belly, and this works best if you can bend your knees, just kind of plant your feet down. Yeah, just like that. Great. All right, and let me know if you have any soreness anywhere where I'm pressing, okay? Anything bother you?
Hurt. It's a little uncomfortable right in the middle.
Right in the middle, right where I am right now?
Yeah.
Okay, all right. Great. Okay, and just take a big breath in and blow it out. Okay, good. Just kind of feeling your spleen and liver, and those feel just fine. Okay, I'm going to do some tapping. Okay, great. That's all we need to do today, so you can
All right.
go ahead and sit up. Okay? We'll go get your mom, and we'll talk about what our plan is, okay?
All right.